Why would you have the right to Medicare? Why would that promise have been made to you, right? Super important. In 1965, Medicare Act was passed. We got Medicare and Medicaid at the same time. And why was that? Because in the 60s, we were dealing with segregation and discrimination. Segregation, not just in everything that you know in the civil rights, but in healthcare. You had colored waiting rooms and white waiting rooms. You had doctors and hospitals that would not treat people of color. Medicare told doctors and hospitals, we will give you federal reimbursement if you don't discriminate against people. If you treat everyone, regardless of their skin color, regardless of their income, we will reimburse you in Medicare and Medicaid. Medicaid was for low income. Medicare was for anyone who was over 65 or disabled. That is the importance. This is one of the greatest civil rights achievements ever. And this is why it infuriates me that a city of New York, a Democratic city, with both a mayor and a speaker and the council body being mostly of women and women of color, that they don't understand the history of Medicare and privatizing Medicare. Why Medicare is so important to the city of New York. That this gave people equal access to medical care and forcing them into a privatized alternative to Medicare, known as Medicare Advantage, which you hear me say is the default plan in Project 2025, would then bring back us to 1960. Because you're creating a class system once again in access to health care. And we should not be doing that. And how does it do that? Those who make higher pensions can afford to pay a doctor out of pocket that's not in the network and hope that they would get reimbursed by the insurance company, in our situation, Aetna. Those who are on lower incomes like myself, my pension's a $35,000 pension, or some of our other retirees who make $10,000 or $12,000 or $20,000 pensions, they'd never be able to afford to pay someone, a doctor, up front and hope that they get reimbursed. One, they may not even have the cash to pay the doctor for that office visit up front. And two, pray that they get reimbursed. And if they don't, they're really screwed. Look at how many of you guys are dealing check to check, even just not getting your Medicare B premiums timely, that you're not getting them for 16 to 22 months later. Okay? This is serious. This has major ramifications for your financial and your health well-being. There was a video that I'm trying to get access to that I sent an email out about today, because I think it's really important that we remember what Medicare is for, why we got it, and who it benefited. And this is really important because people just don't remember. And this is really scary to have to keep educating people about. This film is it's Bullfrog Films, and it's called The Power to Heal. This is only like 2.5 minutes, so bear with me. I want you to watch this.
For most of America's history, a system of racial segregation dictated every aspect of life. In no area was this more true than in healthcare.
You think about the civil rights movement, you think about housing, public accommodation, education. But I think the story hasn't been told often about what happened in terms of the institutions of medicine. So that's an unrevealed part of the history.
In 1965, as the civil rights struggle escalated, Black Americans were in the streets fighting for justice and equality. They were being attacked and killed. But a different kind of violence was taking thousands of Black lives every year. Segregated medical care was a brutal reality for Black Americans.
Negroes had one ward. If you were dying from cancer, if you were there to have a baby or whatever, you're on the same ward.
Everything was segregated, not just the hospitals, but physicians' practices. I was the only Black pediatrician in the entire state.
People were dying as a result of that segregated system.
The 1964 Civil Rights Act tied federal funds to desegregation. Now Medicare, with its promise of federal funds, created an opportunity to end the shocking inequalities in medical care. This is the remarkable story of how civil rights activists and the federal government, working together, desegregated thousands of hospitals practically overnight, bringing life-saving care to millions of Americans. This little-known story reveals the role of countless people who never took center stage, but whose shoulders we stand on.
What do you think of that? That is powerful, and that is why we have Medicare. This is why I keep saying what I say. The council has to be reminded that this is a powerful healthcare benefit. There's a full video. It's an hour-long documentary, and I'm trying to get access to it. It is really, really important for you guys to keep educating your council members